Suspected there would be based on that PSA test. Let's review the options that we've talked about. There's surgery, which is an operation called radical prostatectomy. It can be done through an open incision, which is the traditional way. It's been around for decades. Or it can be done the newer way with a robotic assistant. Another option is radiation therapy. Radiation can be given as an external beam, which we call IMRT, or it can be given as radioactive pellets or brachytherapy implanted directly into your prostate. If you want to use a proton machine, you have to go to where that machine is, and there's several around the country. Another option is active surveillance. You go onto a rigid protocol of regular PSA tests and regular repeat biopsies, and if it progresses, then we revisit the idea of considering active therapy.
It would be nice to be around for the next 10 years without the use of catheters and diapers and other things if it was not necessary to save my life.
The prostate cancer can be treated very effectively, but it's not free. The human cost of that treatment in terms of urinary problems, sexual problems, bowel problems may all be significant.
You might say, gee, how is a patient possibly going to decide between these therapies with so little evidence to guide us about whether one is better than the other in terms of either cancer control or side effects?
People rely on us to help them make decisions. But if it turns out that your doctor doesn't have information about which one is good and which isn't, and your doctor could do a much better job if she knew that, because we studied it, and we said, this treatment's good, this treatment isn't good, that test is good, this one isn't, that would help your doctor help you make a decision. Why don't we do the type of research that tells us what actually works and what doesn't work?
So the first question is, do I recommend that you be treated? There are a few reasons I do recommend.
Until we as a nation start to measure the effectiveness of what we're doing as a routine part of practice, we are flying a healthcare airline with no instruments. We are crashing. We don't know how high we are, we don't know where we're going, we don't know how much gas is in the tank, because we don't measure the effectiveness of anything we do in healthcare.
Medicine really has been this cottage industry where each doc learns from an apprentice model and then goes and practices in their own little private practice. If you don't pool that information together and really use evidence as a way to come up with decision making, you never advance.
I had a blood test and was a little surprised to get a